Hello everyone, my name is Ahmed Mattar, one of the orthopedic junior doctors from Princess Royal University Hospital, King's College Trust. Me and my colleague, Dr. Audrina, we did this project about lung biopsy. The idea of this project and the background that we, as you all know, that patients with suspicion of lung cancer, they need to have a lung biopsy. And our audit is to check the outcomes and complications for any patient who has a CT-guided percutaneous lung biopsy and checks the outcomes, if there's any complications like pneumothorax, hemothorax, or hemopneumothorax. We collected the data for patients admitted in Princess Royal Hospital, in our hospital, and checked the outcomes and the complications if there is any complication. The aim is to review and to check the outcomes as we mentioned, and the methodology was showing the inclusion criteria for any patient with suspected lung cancer reviewed in the MDT and went for the lung biopsy procedure. Number two, from the inclusion criteria, it's showing that the patient should have, after the procedure, should have a chest X-ray and perform it at least after 4 hours from the procedure. And we check the outcome within 30 days of the procedure when it was done. The result is showing that 132 over the last 3 years, 132 patients met the inclusion criteria, and the result is showing only in 15% of the patients, which represent 20 patients, got significant pneumothorax. So 20 patients from the 132 showing significant pneumothorax, and only 7% from the 132 required admission to treat the complication like pneumothorax or others, which represent 9 patients for pneumothorax management, and only 1% of the patients required intervention like chest drain insertion. So the conclusion of this project that the CT-guided lung biopsy is a safe procedure in terms of the results, and even if there is minor pneumothorax or hemorrhage, which is common, but only 5.6 of the patients, percent of the patient required treatment, and this is looks like the safe procedure. Here we check the results to this chart. Only 7% were admitted, and here 15% of all of the 132 patients, only 15% got the complication in terms of the pneumothorax. Thank you.